Hey guys, it's Paul. I'm coming to you from the Smith & Jones newsroom with a breaking story. And I think this is our first industry news story that we're doing. We don't often publicly comment on legal matters, but this story has a lot of folks in the healthcare space buzzing about branding, which is why we're talking about it. Now, maybe you've seen this story in Becker's, or you're reading about it in the New York Post, Newsday, some other publications, especially on the East Coast. And if not, we wanted to share this news in our commentary. So, what's the story? What's at stake here? What are we talking about? It's the NYU Langone lawsuit against Northwell Health hospitals over their encroachment on the brand, which is why the topic matters to us. For a little bit more about this, Dave, let's roll this clip from New York's Fox 5.
Jessica Formoso is live in the newsroom with more on this color war. Jessica?
Good evening, Steve and Natasha. After speaking with an attorney and experts in marketing, they tell me no one can own a color or copyright a color. NYU Langone alleges what Northwell has done is confuse the public and trade on NYU's quality and safety reputation. NYU Langone Health System and Hospitals is suing its competitor, Northwell Health, for deceptive trade practices. The lawsuit alleges Northwell intentionally copied its unique color purple, creating confusion because of how similar their advertisements are. On the right is an ad for NYU, on the left, one for Northwell.
They're alleging that there is confusion. And really, that's the main basis of this case, whether they can prove that the average consumer truly is confused.
NYU says the color purple is, and for over 150 years, has been closely associated with its hospitals and brand, accusing Northwell of scheming off the goodwill and reputation of NYU Langone because it was named the top hospital in New York and the third best hospital in the country this year by U.S. News and World Report.
New York University is alleging that there's, in addition to the color, there's also very similar style fonts, colors.
Mark Damasio is the founder of a branding and advertising agency here in New York City.
They could merely claim that Northwell's use of the color is confusing and therefore infringes on their market space without going the step further that they did and implying that they intended to do it.
In a statement to Fox 5, the senior vice president and chief marketing communications officer for Northwell says NYU Langone's claim that it owns the color purple for healthcare services is nothing short of preposterous. He went on to say Northwell Health is proud of its distinct branding. NYU firing back, calling it a shameless effort reflecting poorly on their imagination and industry, saying, quote, "This is a clear violation of NYU Langone's branding and marketing, which even a casual observer would see as an attempt to copy our campaign." And attorney Jonathan Ellis says this case is going to be hard to prove, calling it a novel issue, saying usually trademark matters involve items or formulas. Meanwhile, NYU Langone is seeking damages, attorney fees, and a permanent injunction relief for unfair competition. Steve, Natasha, back to you upstairs.
Fascinating case. All right, thanks, Jess.
So, yeah, there's a lot at stake there. And found it fascinating that one of the things that has to be proven in a court of law is that the average healthcare consumer is confused. And as you've heard us say on these webinars and conversations that we've had, the healthcare marketplace and system can be very confusing for everybody. So why make brands even more so? So what are we talking about? Natalie O'Neill from New York Post basically summarized it very well when she said NYU Langone system is, well, as the Post always does, seeing red or plumb wrong, and suing to block Northwell from running ads that the former said are mimicking its long-established brand, color palettes, and encroaching on its reputation. So what's at stake here? Well, essentially the battleground is New York Metro and Long Island markets. If you're not familiar with that, it's essentially the 5 boroughs that comprise New York City and Long Island, which is a total of 15 million people. That's not insignificant. The other battleground, though, is in basically the brand in the minds of consumers, and I think that's a lot of what was covered in the Fox 5 clip. So Dave Muio from Fierce Healthcare commented and wrote that Langone codified the use of the color purple along with preferred accent color combinations, typography choice in an internal advertising style guide developed in 2017, and that was used throughout today. The system, as you had seen in that clip, deployed tons of brand materials and physical and digital marketing campaigns that generated over 400 million impressions per year, and for which is spent $25 million per year purchasing ad space. So that's pretty significant. That's a lot of brand equity, and that's something that's worth protecting. As you see these assets here, not as heated or direct as what we've talked about before. But as you've heard us say in other previous webinars, brand and those brand assets really need to be protected as much as an institutional's tangible assets. So let's explore, and you've heard us talk about these case studies in the past. Pan Am went into bankruptcy court in the mid-90s. At that time, the planes and the hangars and the typewriters and everything else were up for sale during typical bankruptcy auction. But they also sold the brand identity for $1.5 million, and someone bought it. The theory being that in the future, someone may want to launch an airline, and launching it on an existing brand would be way more powerful and would get that brand up to speed and compete faster in the market than a brand starting from scratch. There's the old example in business school with Campbell's Soup. Two people on opposite side of Campbell's decided to separate and divide the company. One person keeps the brand identity and starts over on everything else. The other person abandons the brand identity but retains the farms, the canneries, the distribution, networks. And fast forward 5 years, the question is who's going to be up to speed faster? And frankly, that's exactly what Sara Lee did about 10 years ago, actually about 15 years ago at this point, when they said, we're selling all of our bakeries, we're subcontracting all of that, we're just going to simply focus on building brands. So brands have value. You've seen some of these national examples, and given not only the population that's at stake, the dollars that are investing, it's worth protecting. I think it's worth a legal fight. I think it's worth determining who got to market first, or whatever the legal issues are that could determine that outcome. So let's take a closer look at some of the images that Fox 5 had put on their website. And you saw these briefly in the clip. On the left, you'll see Langone's materials, and these were dated and developed in March of 21, November 19, throughout that time period. And the Northwell example is on the right, November 2022, October 22, January 22. There's another example here of some digital ads, maybe not as direct, but still, somewhat interesting. Langone's looks to get there first in January of 21, with Northwell in September of 21 of that same year. So going back a slide for a second, it's essentially, a pretty interesting case that they're making. And please, let us know what you think. We'd love to hear your comments. Drop us a line, post some comments here on social media or on our website, depending on where you might see this. So what is this sea of sameness? This is sort of the issue here of blurred and competitive brands that seem to be encroaching on each other's identity. And while the issue might be technical in nature, who got there first really might be at stake. I don't know. I didn't go to law school, and I was sick that week in pre-law. But this certainly sparks a larger conversation and what we wanted to talk about as well. So Naomi Diaz from Becker's recently described and used this term sea of sameness concept, which refers to when healthcare marketing and advertising really look similar across a lot of identities and causes either friction or confusion between hospitals and health systems that are looking to stand out from their patient communities. Paul Mattson, Chief Marketing Communications Officer at the Cleveland Clinic, recently used that phrase and told the Marketing Brew, in the healthcare space, a lot of the advertising looks identical. It's often been referred to as a sea of sameness. And how right he is. So let me take you through a few slides coming up here. And this is the headline that I was just talking about a second ago. But these are merely icons, stock images that you can purchase, but when we look at corporate identities, as we're looking to develop a logo and rebrand an organization, I think that competitive audit, more on that in a second, is really essential. So many institutions are using crosses and heartbeats and helping hands, to form an identity and claim to differentiate themselves when it does fall into that sea of sameness term as well. Employee team photos, you might as well be using this. Everything seems to be the same. There's that saying that every doctor wants a billboard. And I'd be remiss if I didn't share a couple clips from the webinar that Richard Skierman, our creative director, and I gave about a year ago. At the time, we were talking about how organizations can stand out from this sea of sameness. And so let me just go through these clips. I was going to play a video of this, but I just want to share a couple of these. And this is from Healthcare Advertising Beyond the Cliche physician photo that Richard and I did in May of 2022. So we kind of walked through this and basically said, yeah, these are familiar images, stock photos that you can get from a number of different websites, where you see this smiling physician, very charismatic, spending time listening to his patient, all those things that really matter that we've talked about. And this physician is apparently an orthopedist, or certainly an expert in, back and neck injuries, perhaps, spending time with his patient, all the kind of things you would expect to see from a series of stock photos about a physician, not particularly differentiating, but certainly very familiar. There he is again, spending time with his patient, just really listening to everything she has to say. And hey, what doctor, doesn't play golf on the weekends and maybe go off to Aspen, to do a little bit of skiing? So certainly you can find this very well-rounded, three-dimensional, person who has a good work-life balance. There he is again, rollerblading, and just relaxing with a morning cup of coffee, probably decaf, again, with his, spinal expertise, he may be recommending decaf for a number of his patients. And certainly, as we look to relax, beyond those leisurely mornings with the morning paper, you might do a little gardening or be found at the grill. But who can make ends meet as a doctor, right? We talked about this in 2022. So he's got this side hustle as a chef and maybe a carpenter, and one that, recognizes the importance of staying hydrated. But at the end of the day, he really is a trusted physician, and one that, again, listens to his patients and really builds quality relationships. Except when he's also a patient, and that happens apparently more often than not, according to all of these stock photos. So, the point that we were trying to make and why we swim in this sea of sameness is that it's very easy to fall into this trap. Budgets don't always allow for the time and resources we might want for competitive audits and to be able to look and see what we're differentiating from. Certainly those images are safe. Nobody's going to get fired for, using an image like that, for instance. It seems certainly very appropriate. It's fast, it's easy, it's inexpensive. It's much easier than casting and conducting a photo shoot. And sometimes it makes sense to, blend in with your competition. We've seen the branding strategies for a lot of the offshore medical colleges looking to compete, and be held in the same regard as some of the domestic colleges with identities that are, pretty much the same. So how you can break through that and what those alternatives might be? Well, clearly, doing your research. I think understanding what your competition is doing and saying, in some cases even spending, where they put their advertising out, what are the messages, and what's that color palette and the identity that they're using. Clearly, that's what you want to do. You want to differentiate your organization from that. But what really sets your organization apart? Is it what the consumer wants? Is it, differentiating? And if you're having troubles and struggling trying to find that true point of differentiation, I think it's time to bring that conversation to the boardroom. What is it we're doing? What's our reason for being? And why are we here serving the marketplace that we are in a way that people can clearly decide they want to choose our hospital or health system over another? If you come up with we're like a family, I think it's time to start over again. I think it's time to, really push those boundaries. An old mentor of mine, Jack, had said, if it's easy to approve, it's not memorable. And what he meant by that is we want our clients to have just a little bit of healthy heartburn. We want them to be a little off balance, maybe have a little agita. If it's something that's as safe as those stock images that you just saw recently, then it's not going to break through the clutter. There's an old saying that a good ad does the work of 10. You don't have to triple and quadruple your media budgets if you push your creative to be truly differentiating, to really get at what consumers need and want, and really what motivates them and what sets your organization apart. Push those boundaries as you're going through. And this was something that our colleagues have done. I think some of you that saw us on the lecture circuit this year, MashMed and Neshco, you saw us carrying the Ellis Medicine HR campaign. I think this was, we know it was especially impactful, and we were able to measure that. But to lead with a campaign that says we don't just hire employees was bold. I think it took a lot of guts for Lisa, our writer, to write that and for our client to approve it. Imagine going to your HR department, essentially that's what happened, and said, we have an idea for a headline. It says, we don't hire employees. But the payoff to that, we invest in them, and the meaning behind that, and the fact that that resonated so powerfully with so many of the nurses, lab techs, folks, it really got to the heart of what was very important to them, in that type of culture. I really think there was a missed opportunity. I think the collective responses that were put out there, let me go through the rest of the Ellis Medicine things here. The collective responses out there were legal, but they could have put in their holding statements maybe a little bit more about that differentiation and how nobody could have possibly confused our quality, tech, et cetera, with the other organization. So what's next? We'll be keeping an eye on this. We'll be monitoring this lawsuit. We'll share the outcomes in the future. In the meantime, we'd love to know what you think. What are you seeing? Do you have other examples to share? A different point of view? Please tell us in the comments. Send or share an email with us. If you need help auditing your brand, keep an eye out for our new brand hospital marketing plan workbook tool, which will be released soon. Katie, Lisa, Mitch are all working on that, and that's expected to roll out in the next few weeks. And mid-September, we're going to be on the floor of SHSMD in Chicago, where we'll be releasing our 11th annual Trends Report. All those highlights are available and insights on our website. Go to smithandjones.com. You'll see the Insights tab, and you'll see all of these types of webinars, a lot of the conversations I was referring to here, white papers, trends reports, and the new marketing tool to help audit your brand as well. So, interesting news. Glad we could have a chance to sit down and share it with you. From the Smith & Jones newsroom, I'm Paul Fahey.